and welcome to Health Chat program. This is a program that looks at different ailments concerning our well-being and our wellness. And so today we are in Kabwe where we are celebrating maternal issues. And this week is Safe Motherhood. And in it, we are also looking at the International Day to End Obstetric Fistula. And so to help me look at this, I have with me Kalumba Kaputo, who is the Senior Programs Officer from the Fistula Foundation, to just take us through and learn how this institution or how this organization is helping out our mothers to have a better life in terms of fistula. Welcome to today's program.
Thank you, Madam. Good afternoon, viewers, and good afternoon.
Thank you so much for allowing us to have a conversation with you. We are looking at fistula, maybe just in general and in brief. What is fistula?
Fistula is a childbirth injury which occurs during labor or childbirth. Usually when there is a complication during childbirth, a mother will end up with a hole or connection between the urinary bladder and the birth canal, or between the birth canal and the rectum. So when a woman has that problem, she will start experiencing leakage of urine or even fecal matter through the birth canal without control. So that is what we call obstetric fistula.
Great. Now we are looking at this day, which is really, really important when we talk of the International Day, to end obstetric fistula. And now you are part of this organization, the foundation, that is looking after these issues. Why did you come up with this foundation?
Fistula Foundation, of course, it is an international organization. We are working as a registered NGO in Zambia to support women who do suffer from this problem of fistula. So we discovered that there was a need. Back then, before we started in 2017, we just had one hospital where women who had this problem could access treatment. They could go to as far as Southern Province. And mostly we had women coming from the northern part of our country. So traveling all the way to Southern Province was an issue. At times, most of these women couldn't afford even transport logistics to get to the hospital where they could access treatment, then in Mwanza. So Fistula Foundation thought it important to come in and bridge the gap by creating what we are calling a fistula treatment network. We have established, in partnership with the Ministry of Health, partner treatment hospital in each province. As at now, we are in 8 provinces where we are working with the Ministry of Health structures to support our mothers who have this problem access free treatment.
Great. You are talking of your, headquarters, I would call it, to be in northern, in Fistula province.
Yeah.
To be specific, Mansa. Why did you choose that place to start with?
Okay, thank you so much. As I stated earlier on, when the organization started in 2017, of course we had to seek audience with the Ministry of Health as our key partner. And they advised us that back then, Fistula province had challenges in terms of indicators relating to maternal health. So we were advised to start our work that side, and we planned that we'll be doing it on a rolling phase. So we had to look at where our need was great, and we thought it wise that we should have our national office in Fistula province. But that doesn't mean that we don't go out to other areas. But that specifically was driven by the fact that we had a lot of cases that side. So we decided to bring ourselves closer to where our services were most needed then.
Looking at back then and now, you are talking of not having enough doctors to look at this. How have we progressed? Do we have enough for now compared to then when you started as a foundation?
When we started in 2017, we had very few specialized surgeons. who were dedicated to provide fistula repair surgery. There were just 2 that were
That was countrywide.
that were qualified under what we call the FIGO standards. There is an international global organization that spearheads fistula surgery repair, the International Federation of Gynecologists and Obstetricians. So we just had 2 when we started. Of course, there were others who were interested, but they had not attained that level of competence where they could be certified by FIGO. But as I'm talking through our efforts, because it is one of the key areas of intervention that we are doing to provide capacity building to our treatment centers through healthcare provider training. So as of today, we have 7 FIGO accredited fistula surgeons. Then aside, we have about 9 other dedicated surgeons who I can say trainee surgeons who are not yet certified by FIGO standards. So I can say we've progressed enormously, unlike the way it was, because we have challenges where you have patients, but we don't have the surgeons to do them.
We're talking of having 10, provinces in Zambia. You have said you have actually outreach, or you have reached out to these other provinces. How many are we talking of in terms of provinces coverage? Where are we, and do we have surgeons in those provinces that are present?
Thank you so much. When we started, we only had 3 provinces in 2017. That is Muchinga, Luapula, and Central Province. And of course, we had a surgeon in Lusaka, but by then he wasn't actively involved because we were doing more like a camping model. Patients were not going to the hospital. But as at now, I can say by the end of December, we had reached out to 8 provinces. And in all these 8 provinces, we had dedicated surgeons. We are only remaining with Western and the Copper Belt province where we haven't fully fledged a treatment site. But I'm happy to say that we have a dedicated obstetrician who is on board in the province. Of course, patients are usually getting to Luapula province, which is the nearest treatment center, and some come to Kabwe Central Hospital. But we see in the near future to have a dedicated treatment center that we can partner with.
That really sounds good. You have mentioned really of the presence in all these places at home, and you have actually spoken of capacity building. If you look at your foundation, how much are you doing, and how many can you even point at to say maybe you have sponsored so many trainees to go and acquire this information that we need for our specialized surgery? How many are we doing?
Thank you so much. In terms of capacity building, we have sponsored 7 surgeons to undergo full-time training. But aside that, we have a structured approach where these expert surgeons are transferring their skills to the local resident surgeons through some kind of mentorship. So since the inception of our program, we have conducted about 94 mentorship visits to almost all our treatment centers, where these expertise surgeons are able to transfer their skills to the upcoming surgeons, trainee surgeons. So among the surgeons that have been mentored by the 7, we have currently 9. So in total, I can say we have 19 dedicated surgeons. Then aside that, we are also supporting the training of ward nurses. You can have a surgeon, he or she does the perfectly. But if the patient is left in the ward, there should be a qualified fistula nurse who can provide at least specialized nursing care. so that the surgery outcome can be positive. So we have had two nurses that have undergone specialized fistula nursing care training. Then these have done mentorship to now 237 ward nurses. So we are saying at least today a good number of people are aware of the problem, because previously very few knew about fistula. It could sound as if it is a strange disease which has just come today, like COVID-19, the way it came. But now everyone knows that there is this problem of fistula which can affect a mother if she doesn't access adequate obstetric care during childbirth.
It really sounds good, and now that we are looking at safe motherhood, looking at this launch and the awareness campaign that we are witnessing just today, why did you think of being a part of this great thing when we talk of safe motherhood? Why did you even feel to say we should be a part of this? What have you brought to the when you look at this one?
Thank you so much. As Fistula Foundation, we strongly believe that no woman should live a life of misery for simply trying to bring a life on earth. So this fistula is as a result of a woman trying to bring a new life on earth. But in the process, she develops this childbirth injury condition. So if you look at safe motherhood, it all starts from a safe mother before pregnancy, a safe mother during pregnancy, a safe mother after childbirth. So our coming in is the cry of that woman who, because of childbirth, has become unsafe. She can't lead a normal social life. Remember, a woman who is always leaking urine or stool, has that foul smell. She can't be part of social activities. Culturally, our women gets to what you call chilangamulilo, those weddings where women gather. But a woman with fistula, I don't think it is possible. To some extent, some of our mothers, they even fail to attend funerals. You know, our culture, our women will be together during the funeral, and when colleagues discover that amai nini banunka mitumbe, she's smelling urine, and because of the lack of awareness, they would say, "Watu, she's always bedwetting." So, as a Fistula Foundation, we see to it that we have to be part and parcel to commemorate the Safe Motherhood Week, together with other partners who are there to ensure that safe motherhood. No wonder we are happy the way the ministry had to structure it to make it fall under this special day, May 23rd, which was set aside by the United Nations, where we together have to raise a call for action that no woman should live a life of misery because of childbirth due to obstetric fistula. It's our prayer as the foundation that we'll have no woman with fistula by 2030. Yeah, in Zambia.
It really sounds to be a good hope for our mothers who are actually undergoing this type of problem. But from the inception, you're talking of 2017. Can we talk of success stories that we can relate to say? Actually, as a foundation, we are happy because so many of our women are now smiling. They did not have hope, but at least for now, they are able to smile because at least we have given them a second chance. Can we talk of success stories?
You are very right. You know, we believe in the words of there's this atheist, Peter Singh, who says, doing good better. Everyone is doing what is good. But as Fistula Foundation, we believe to do that which is good better than it can be done. when we started in 2017, we only supported 235 women.
That was still a good number.
But as of today, close to 3,000 women have accessed this life transforming surgery. About 2,850 women have received this life transforming surgery. And we are happy. It's like we've raised the banner. These have gone in the flat out to call upon every woman. Because when we started, even mentioning fistula, it would sound as if you are talking something that attracted some kind of stigma. But we are happy today, even when I have a cape, some people in the streets will say, I need a cape for fistula. I need a t-shirt for fistula, meaning we are somewhere. Not only in terms of treatment, but in terms of mobilization, raising awareness.
We are happy to hear that, and we know that for sure this is bringing good hope to our women and just a leaf of life, a new leaf of life to the womanhood, and this is also safe motherhood. But maybe in closing, what would be your word to other people out there who would want to give a helping hand? Do you have any collaborating partners that will work with to see to it that our women are in safe spaces?
Of course, there's a saying where they say, when the river is calm, it doesn't signify the absence of problems. This issue of fistula is everywhere. When we started, we thought it is just in rural areas like in Mansa, where we started. We had a lot of patients from Chirenge as far as Lambochomba area. But as I'm talking my sister right now, we have had a lot of women, even from within Lusaka, who have been living in silent shame. They have been unable to come out in the open. Our call to everyone is to raise a banner. They can find us on Facebook. We are there as Fistula Foundation Treatment Network Zambia. They can find us even through health care structures. When they get to health facilities, they will definitely be linked to where our help will be provided. In Lusaka, we have our dedicated team at Chilenge Level 1 Hospital, University Teaching Hospital, Women and Newborn Hospital, Levi Mwanawasa Medical, University Teaching Hospital. Here in Central Province, we have our dedicated staff at Kabwe Central Hospital and Kabwe Women and Newborn Hospital. In Luapula, as I earlier on said, we have our dedicated staff and even a specialized ward dedicated to our patients at Mansa General Hospital. In Northern Province, we have our dedicated team of care providers at Mbala General Hospital. We are, and we will be more than glad if we hear that. I listened to the radio, I saw about this program on TV. Now I'm at Kabwe Central Hospital receiving care and treatment for fistula. So now my wife, my sister, my cousin is at Chilenge receiving the care. We provide or we support for all that will be needed, including transport for our mothers to the hospital and inpatient logistics like grocery, toiletries, and sanitary, and everything that is required for our care, including transport to get back home. What we believe in, fistula is not something that should be regarded as a case. Fistula is not a sexually transmitted infection. Fistula is not something that is out of negligence. It can affect any woman as long as she falls within the reproductive age group.
Thank you so very much for sharing. It was quite insightful, and we hope that our mothers, our sisters out there have gotten at least a word from what you've shared. Thank you so much.
Thank you so much.
All right. Well, you have heard it for yourself. That was quite an insightful, chat here on Health Chat where we're looking at fistula. Let's see to it that we help our mothers, our sisters because this actually is treatable and it is repairable. And so let's look out for these issues, be it online as well as offline. I was talking to Kalumba Kaputo, who is Senior Program Officer from Fistula Foundation. I've been your host, Faith Mutale, with the Outside Podcast here from Kawe. It is goodbye.